when people do relapse, there's another provider here in my community who very often, if somebody relapses, he kicks them out of his practice, which I find to be very frustrating because we already know that chemical dependency is a chronic relapsing disease. So if somebody relapses, well, because that's how we describe the disease as a chronic disease, that should not be surprising. And rather than telling the person or reinforcing the fact that they are worthless and that they're hopeless and kicking them out of the practice, why not sit down with them and ask them, why did you relapse? Okay, what exactly were you feeling that led to the relapse? Or what was the situation? How can we avoid it? And overall, what did you learn? And hopefully most people learn, and, and not hopefully, but what I'm trying to say is that it turns out that what most people learn is that they don't take their problems seriously enough, that they try to do it the easy way, that rather than, going to the number of meetings that's necessary, they only go once a month. Or, they decided to stop seeing their counselor because it's a hassle. And so we end up going back to that and saying, listen, the lesson here is that clearly, what you have as far as tools are not sufficient enough to deal with the stress that you're under. And, that's what we need to go back to. And so usually when a patient of mine is coming back, having relapse, etc., I try to not focus on, you're hopeless, you'll never get this right, you're out of my practice, to, all right, well, we need to step up our game. I need to see you more often. You need to see your counselor more often. You need to go to meetings more often. You need to refocus on your coping skills. Let's use this as an opportunity to move forward, as an opportunity to give up and to reinforce a lot of that negativity that leads people to relapse in the first place. And absolutely reinforcing the message that the person is not a bad person, but they do have a bad problem that needs to be addressed. And that's usually the most productive way to move forward.